Finally, let's cover the treatment of the diabetes insipidus. Now, first of all, if it is a central type, so what will happen in the central? We know that you have a deficiency of ADH. So all you got to do is to find some ADH analog and get it into the body. So the hormone replacement is the treatment of the central diabetes insipidus, and the hormone replacement is mainly with the desmopressin acetate. Okay, so desmopressin acetate is given, and it is an ADH analog, and it has a longer half-life. It is given, usually it is given intranasally, but it can be given orally or intramuscularly as well. Mainly it is given intranasally. Some other drugs can be given to stimulate the ADH release. Again, since ADH deficiencies there, so some give drugs that stimulate the ADH release, and you have to remember these: the chlorpramide, clofibrate, and carbamazepine. Okay, so the clofibrate, chlorpramide, clofibrate, and carbamazepine. So these drugs can be given. In case of nephrogenic diabetes insipidus, there is already ADH present in the body, but the kidneys are not responding to it. So uh, the main thing to do here is, first of all, correct the potassium, calcium, and stop offending drugs. So these are the reason that why the kidneys are not responding to ADH in the first place. So you have to first take out the pathology from there, and then you can give the thiazide diuretics. You can give thiazide diuretics such as the hydrochlorothiazide, hydrochlorothiazide, or chlorthalidone, etc. So the thiazide diuretic um are useful. Moreover, amiloride, which is a potassium sparing diuretic that treats the lithium induced diabetes insipidus by blocking lithium entry into the collecting tubules. We know that the lithium is one of the drug that causes the nephrogenic diabetes insipidus, so its action can be spared by the amiloride. Moreover, NSAIDs such as indomethacin can be used. A little bit to remember about the pharmacology of these drugs. You know that the desmopressin acetate, it is a long acting synthetic analog of the ADH with high specificity for V2 receptors. It is used in diabetes insipidus as well as in the treatment of von Willebrand disease and hemophilia by acting on vascular endothelium and releasing von Willebrand factor and factor 8. We know that ADH act via two receptor V1 and V2. The V1 receptors were mainly present in the smooth muscle of the where they cause vasoconstriction, whereas V2 receptors are present in the kidneys as well as they were present on the endothelium. And once ADH acted on these receptors in the endothelium of the blood vessels, they used to release factor 8 and von Willebrand factor. So that's why it is used in the von Willebrand disease and hemophilia as well. It can also treat night in uresis, the bedwetting. For the bedwetting you can give it because it prevents the urination, and moreover it is also used in the management of esophageal varices. And how it is used, that since it's constrict via V1 vessels, I told you that it causes vasoconstriction, so it constricts the mesenteric arteriole. So what happened, that there is a decreased portal pressure, and once there is decrease in the portal pressure, so the esophageal varices uh, is not that problematic then. Moreover, it may cause hyponatremia. So it may cause hyponatremia, that is one of its side effects, since it is causing the retention of the water. So what will happen, that the body will absorb more and more water, so as a result the sodium and whole of the serum osmolarity that will go down. Moreover, some other drugs with the vepton suffix such as coniveptan or toliveptan, so these drugs are the ADH V2 analog, V2 receptors analog, and they can also be they are used in the treatment of these are actually these antagonists, sorry, not agonists but antagonists. And you will see that the upcoming syndrome that we will be studying, the syndrome of inappropriate ADH secretion, so it is used, the antagonists are used over there. So just keep that in mind. Keep the whole pituitary, the posterior pituitary medicine pharmacology over here in mind, that one medicine that you have is the desmopressin acetate. The second is vepton, the coniveptan, toliveptan. Moreover, demeclocycline, which is a tetracycline, also treat SIADH via by acting as antagonist at the ADH receptor. So this is another medicine that is used as the ADH antagonist. So drugs they will be used in the these two drugs will be used in the syndrome of inappropriate ADH secretion. Thank you.